Welcome to Senior Health, your trusted channel for practical tips, science-based advice, and compassionate guidance on living a healthier, happier life in your golden years. Today, we are diving into a question that many older adults, and their families, often wonder about but rarely discuss openly. How often should seniors shower after the age of 70 to stay healthy, safe, and comfortable? At first glance, it might seem like a simple question. Most of us have grown up hearing that we need to shower every day to stay clean and prevent odor. For decades, daily showers have been considered a sign of good hygiene and self-care. But as we age, our bodies change in ways that make those old rules not only unnecessary but in some cases even harmful. That's right, what worked in your 30s, 40s, or even 50s may not be what your body needs in your 70s and beyond. The truth is that seniors over 70 have unique health considerations that affect how often they should bathe. Changes in skin structure, immune system function, mobility, and even sensory perception all play a role. The outermost layer of our skin naturally becomes thinner and less oily with age. Oil glands slow down, and the protective barrier that locks in moisture begins to weaken. As a result, frequent washing, especially with hot water and harsh soaps, can strip away the little natural oil that remains, leading to dryness, itching, cracking, and even painful skin conditions. This isn't just uncomfortable, it can increase the risk of infections, because dry, cracked skin is more susceptible to bacteria and fungi. So, if you've been showering every single day out of habit, it may actually be doing more harm than good once you reach your 70s. But before we jump to conclusions, let's break down the key factors that determine how often a senior should shower. First, let's talk about skin health and natural oils. Healthy skin acts like a shield, protecting you from germs and maintaining hydration. In younger people, daily showers might be tolerated because their skin produces enough sebum, natural oil, to replenish the moisture lost during washing. After 70, however, sebum production declines dramatically. A shower routine that once felt refreshing can now cause persistent dryness, leading to itching, flaking, and even eczema-like rashes. Dermatologists who specialize in geriatric skincare often recommend limiting full-body showers to just 2 or 3 times per week, with quick sponge baths or targeted cleaning on the days in between. This balance keeps the skin clean while preserving natural oils and preventing irritation. Second, we need to consider mobility and balance. Many seniors face challenges such as arthritis, muscle weakness, or reduced flexibility, making daily showers physically demanding and sometimes dangerous. Bathrooms can be slippery environments, and falls are one of the leading causes of injuries among older adults. If showering every day increases the risk of a fall, it's not worth the hazard. Instead, seniors can prioritize safety by showering less frequently but more mindfully, using non-slip mats, grab bars, and shower chairs. A well-planned bathing schedule, such as showering every 2 to 3 days, allows for safe, thorough cleaning without the pressure of daily effort. Third, body chemistry and odor also change with age. While some people worry that showering less often will cause unpleasant smells, the truth is that seniors generally sweat less because their sweat glands become less active. Less sweat means less odor. Of course, certain areas, like the armpits, groin, and feet, still need regular attention. That's why on non-shower days, a quick sponge bath focusing on these key zones is more than enough to stay fresh. Wiping with a warm, damp cloth or using fragrance-free cleansing wipes can maintain cleanliness and confidence without exposing the entire body to drying soaps and hot water. Another critical consideration is medical conditions and medications. Many seniors manage chronic illnesses such as diabetes, heart disease, or kidney problems, and some of the medications prescribed for these conditions can affect the skin. Blood thinners, for example, make the skin more fragile and prone to bruising, while certain blood pressure medications can increase sensitivity or dryness. Overshowering when the skin is already vulnerable can exacerbate these issues. On the other hand, if a senior is incontinent or has a condition that causes excessive sweating, more frequent bathing may be necessary to maintain hygiene and prevent infections. The key is to adjust the bathing schedule to individual health needs, with guidance from a doctor or dermatologist if needed. Let's also talk about mental and emotional well-being. Bathing is not just a physical act, it can be deeply tied to self-esteem and routine. Some seniors find comfort in the ritual of daily showers because it makes them feel refreshed, dignified, and in control of their day. For others, the effort and risk of showering daily can cause anxiety, especially if they fear falling or feel cold easily. In these cases, finding a middle ground is essential. For example, a senior might enjoy a warm, relaxing shower twice a week combined with daily face and hand washing, dental care, and light sponge baths. This approach keeps hygiene and dignity intact without unnecessary stress. So, what's the ideal bathing frequency for most seniors over 70? While every individual is different, experts generally recommend showering 2 to 3 times per week as a healthy baseline. This allows the body to stay clean and fresh while protecting the skin's natural barrier. On days when a full shower isn't needed, a simple routine of washing the face, underarms, groin, and feet is usually sufficient. It's also important to use lukewarm water instead of hot water, as hot water strips natural oils more aggressively. Gentle, fragrance-free cleansers or moisturizing body washes are preferable to harsh soaps. After bathing, applying a rich, fragrance-free moisturizer while the skin is still slightly damp can help lock in hydration and prevent dryness. In addition to adjusting how often you shower, how you shower matters just as much. Seniors should avoid scrubbing the skin vigorously, as this can damage the fragile outer layer. Instead, use a soft washcloth or simply your hands to gently cleanse. Focus on areas prone to sweat or odor, like the underarms, groin, and feet, while being gentle on drier areas like the arms and legs. Keep showers short, ideally under 10 minutes, to minimize water loss. After bathing, pat the skin dry with a soft towel rather than rubbing, which can irritate or tear delicate skin. Let's not forget about hair washing. Just like the skin, the scalp produces less oil with age, so seniors often don't need to wash their hair as frequently as they once did. Shampooing once or twice a week is usually sufficient for most people over 70, though this can vary depending on hair type and personal preference. Using a mild, sulfate-free shampoo and a moisturizing conditioner can help maintain scalp health and prevent itching or flaking. For those with limited mobility or chronic conditions, alternative bathing methods can make hygiene easier and safer. Sponge baths, no-rinse cleansers, and disposable cleansing wipes are excellent options for in-between showers. Bed baths can be performed with the help of a caregiver if necessary, allowing seniors to stay clean and comfortable without the risks associated with traditional showers. These alternatives are especially helpful for individuals recovering from surgery or illness, or for those who find it difficult to stand for long periods. Let's also address some common myths about senior bathing. Myth number 1: you have to shower every day to be healthy. This is simply not true for older adults. As we've discussed, daily showers can actually harm the skin and increase health risks. Myth number 2: less showering means more odor. Again, because seniors sweat less, body odor is typically less of a concern than people think. Proper spot cleaning and good clothing hygiene, like changing undergarments daily, are often enough to prevent odor. Myth number 3: skipping showers is unhygienic or lazy. In reality, adjusting your bathing schedule to meet your body's changing needs is a smart and proactive way to care for yourself. Families and caregivers also play an important role in supporting healthy bathing habits. If you are caring for an elderly loved one, it's important to respect their preferences while encouraging safe hygiene practices. Offer to help with setting up the bathroom to minimize fall risks, install grab bars, use non-slip mats, and ensure the room is well lit. Warm the bathroom in advance to make the experience more comfortable. Encourage moisturizing after each shower and provide gentle products designed for sensitive skin. These small steps can make bathing safer and more enjoyable, reducing anxiety for both seniors and caregivers. Another valuable tip is to listen to your body. If your skin feels tight, itchy, or flaky, it's a sign that you may be showering too often or using products that are too harsh. Adjust your routine accordingly and speak with a dermatologist if problems persist. Seniors with certain skin conditions, such as psoriasis or eczema, may need customized bathing schedules and specialized cleansers to avoid flare-ups. Let's also talk about the seasonal factor. During colder months, indoor heating and dry air can further deplete skin moisture, making it especially important to avoid overshowering. In winter, many seniors may find that showering just twice a week is sufficient, with daily spot cleaning to stay fresh. In warmer, humid climates, showering 3 times a week or more might be comfortable as long as gentle products and moisturizing habits are maintained. Beyond hygiene, bathing can be a wonderful opportunity for relaxation and self-care. A warm shower can ease stiff muscles, improve circulation, and even promote better sleep when done in the evening. Adding a soothing element like calming music, a soft towel, or a favorite moisturizer can turn shower time into a moment of enjoyment rather than a chore. Seniors who find showering stressful can benefit from a consistent routine, such as showering at the same time of day or pairing the experience with something pleasant, like a warm cup of tea afterward. Ultimately, the best bathing routine is the one that balances cleanliness, comfort, safety, and skin health. For most seniors over 70, showering 2 to 3 times per week, combined with daily spot cleaning, is the sweet spot for staying healthy and feeling fresh. Remember that your body's needs are unique. What matters most is listening to your own skin, staying alert to changes, and making adjustments as needed. Don't be afraid to talk with your doctor or dermatologist for personalized guidance. Here's a quick recap for easy reference. Most seniors should aim to shower about 2 to 3 times a week. Use lukewarm water, gentle fragrance-free cleansers, and moisturize afterward. On non-shower days, perform a quick sponge bath to clean key areas like the face, armpits, groin, and feet. Keep showers short, avoid hot water, and dry the skin by patting rather than rubbing. Install safety features in the bathroom to reduce the risk of falls, and choose mild, hydrating shampoos for hair care. At Senior Health, we believe that aging gracefully means respecting your body's changing needs and making choices that promote both health and happiness. Showering less often is not a sign of neglect, it's a sign of wisdom and self-care. By adapting your routine, you can protect your skin, reduce your risk of injury, and maintain a sense of comfort and dignity well into your 70s, 80s, and beyond. Thank you for watching this detailed guide on how often seniors should shower after 70 to stay healthy, safe, and comfortable. If you found this information helpful, please give this video a thumbs up, share it with your loved ones, and subscribe to Senior Health for more expert advice on aging well. Your body deserves kindness, and your health deserves attention. Let's continue this journey together.